Hello everyone, for this video we will be going over archery adaptive equipment for people with SCI. Adapted archery is very similar to traditional archery, however adaptations for archery are available to accommodate client factors for varying levels of SCI. Firstly, participants should decide between using a recurve or compound bow. A recurve bow is known for being lighter in weight, but drawing back the arrow may require more strength. Conversely, compound bows are shorter and may be easier to draw back. These factors, in addition to being able to be utilized with a bow mount, may make using the compound bow easier for seated archers. Other adaptive equipment that participants may use with the bow include mechanical release aids, mouth tabs, bow mounts, strapping systems, quiver stands, and quad gloves. Mechanical release and mouth tabs assist with the drawing and release of the arrow on the bowstring. Finger tabs or gloves are used for people with full function in their upper extremities but need assistance with gripping. A caliper release aid with wrist strap is used for people with deficits in fine motor skills. The release mechanism on this can be set through touching the cheek or another body part to the trigger. Thumb release aids are utilized with more experienced archers and have a trigger extension that releases the string. The back tension release aid works as a hinge and can be utilized by archers with limited to absent use of hands. With the ease of the release system and difficulty of use, the back tension release aid is also recommended for more experienced archers. Strap-on release aids can be strapped to the archer, such as the shoulder, and are set off with a finger or chin. Shoulder mount release aids are custom made and are used by having the bow fitted to the harness on the archer's shoulder. The release is then triggered by the archer's face. Mouth tabs can be used for archers with very limited or absent function in their upper extremities. The mouth tab is placed between the archer's molar to draw the arrow back, hold, and release. An additional accessory known as quad gloves are used for people with no function in their hands, which allows them to grip items such as the bow. The bow mount, wheelchair bow slinger, and slings can facilitate increased stability and support when using the bow. Bow mounts or bow stands are used so the bow is stabilized and the archer is only responsible for drawing back the bowstring and releasing. There are horizontal and vertical bow mounts available for people with significant client factor deficits due to motor dysfunction, spasticity, or paralysis to promote occupational participation and performance. These mounts are versatile and can be used freestanding or attached to the wheelchair. Quiver stands are used so archers with limited mobility do not have to engage in additional movement to retrieve arrows. Some quiver stands can be attached to the archer's wheelchair as well. To promote trunk stabilization, strapping systems may be used for wheelchair archers. It is intended that adaptations should be made to the archer's client factors rather than the archer adapt to the bow. However, minimal adaptations are recommended so independence and engagement are optimized. Thank you for watching. Subscribe for more information on outdoor recreation for people with SCI. See you next time.